Hi, my name is Barry Parisian. I'm a denturist and the owner of the Parisian Denture Clinic in Windsor, Ontario. And as you can see, I'm filming this out of my house right now. Today is March 27th, and we are in the midst of the COVID-19 outbreak around the world right now. My office has been closed since March 16th. We are only taking on emergency cases like pretty much every other dental office is right now. But despite all that, I still wanted to get started on the new series of videos I wanted to do for questions and answers, because I get a lot of questions from you guys, and some of them I can't answer. So I'd like to get started with that. So the first question I have here is, I'm so afraid of leaving the dentist without my dentures after teeth pulled. How long is the wait usually? Because there's no way I'd go anywhere without teeth in my mouth. Now that's something that I come across on a monthly basis in my practice, especially by people who are having teeth extracted for the very first time, because getting dentures made for the first time is a completely brand new experience. There are a lot of unknown questions, they don't have answers for anything. So the answer to that question, how long you have to go without having any teeth in your mouth, I would say most often you don't have to wait any time without having teeth in your mouth. Most of the time, people can walk out of the dental office with teeth in their mouth so they can leave with a smile. I had made a video previously about the difference between what are called transitional and immediate dentures. So I think it's a great video for you to go and watch. It tells you the differences of the different ways we can replace your teeth when they're being extracted. Now, that being said, there are some instances where you might have to go a certain period of time without teeth in your mouth. Now, sometimes it could be whether it's the oral surgeon extracting the teeth or the dentist extracting the teeth, there could be a medical reason why they're telling you that you have to go without teeth for a certain amount of time. I've seen that period of time being as little as a week or two. I've seen it be as much as 6 months. So it's really hard to tell if there is a medical reason that is stopping you from being able to have teeth placed immediately, how long that's going to be. And your oral surgeon or your dentist would be able to explain how long that would be and the reason for it. Another reason could be just simply because that is either the oral surgeon's or the dentist's preferred method of treating people. We all have different ideas of how treatment should be undertaken. And some people just believe that you have teeth pulled and you don't put teeth in the mouth after a certain amount of time. So that, in a roundabout way, is the best way I can explain it for how to have, or how long you have to go without teeth in your mouth. The real answer is it can vary quite a bit, from having teeth in your mouth right away to several months. So the next question I have, it says, Dr. Barry, thanks for your videos. Now, first of all, I just wanted to take a second and say I am not a doctor. I get a lot of people commenting on the videos who say Dr. Barry, Dr. Parisian, all these things, and I even get it in my practice all the time. Dentures, we are not doctors. It's understandable why people would think we are. We're in the dental profession, and most people think of dentists who are doctors as the ones performing treatment. But I'm not a doctor. So, Dr. Barry, thanks for your videos. They have been very informative. I'm awaiting my set after extraction in USA going on 2 months now. Wow, never thought it would take so long, but a local dentist says longer the wait, the better the chance for healing and the fit in the mouth. Sounds reasonable. What is your take on ultrasonic cleaners for dentures versus typical tablets in water routine, and your perspective on denture adhesive cream versus the denture strips, C-bond and the like, for aiding in retention of the lower denture at least? Thank you again for your time in the videos. Awesome. So again, right off the bat here, we were just talking about how long you have to wait without going teeth in your mouth. And this person's dentist was telling them the longer you go without teeth, the better. So like I was saying, sometimes it's just the dentist's or the oral surgeon's preference. Now they were asking, first of all, about ultrasonic cleaners versus the tablet cleaners. If you have an ultrasonic cleaner, that is awesome. It is going to do nothing but help to clean your dentures better. You can get ultrasonic cleaning solutions that you just put some of the solution in the water and you put your dentures in there, and the ultrasonic cleaner will basically really kind of vibrate is what it does. It'll try to release all of the particles of food and help to get rid of some of the biofilm from your denture. If you're using an ultrasonic cleaner, and this would be the same for any time that you're using any kind of cleaning products on your denture, what you want to do is you want to brush your denture first. Use, whether it's just dish soap and water, or use a cleaner that you get from the drugstore made for dentures. Use that on your denture first. Brush your denture, brush along the outside where the teeth are, brush along the inside where the palate is, and then flip the denture over and brush the inside of the denture, the part that fits up against your gums. So brush that with some kind of cleaner first, and then put it in the ultrasonic cleaner afterwards. And if you do those things together, that denture is going to be immaculately clean afterwards. As far as for the tablet cleaners, same thing. Make sure to brush the denture first with whatever kind of cleaning product it is that you use, whether it's something like a denture cleaning toothpaste or just soap and water. Make sure you brush your denture first, and then when you soak the denture in the tablets afterwards, whether it's just while you're having a shower or bath, or you do it overnight, your denture is going to stay beautifully clean if you do those two things together. Now, there are some cleaning products that you don't want to use on your dentures. I have had many people over the years come in whose dentures, or I should say at least the pink part, the pink base material of the denture, is white. Don't use bleach in your dentures. I know a lot of people think it's going to disinfect it and it'll clean it. It will do that, but it's also going to leach the color from the material, and it makes the acrylic more brittle, has been my experience over the years. You end up having a denture which is more prone to breakage. Also, don't use vinegar. Vinegar is an acid. That's just not a good idea to use on it. So try to stick to either soap and water or the denture cleaners that you can get from the drugstore or Walmart or any place like that. The last part of their question, they were asking what my opinion on was of adhesives versus the denture strips. And really there's three types of main adhesives that I've seen at least. There are powders that you sprinkle on the inside of the denture. There are the paste adhesives, and there are the strips, and then the pads, like a C-bond pad type of material. And I get asked this on a weekly basis, which product is the best for your denture to use. And really, there isn't a right answer for anybody. What it really comes down to is personal preference. I have a lot of people say they do prefer the denture strips as opposed to whether it's the powder or the paste or anything like that. And what everybody has told me is that they feel that the strips have just the right amount of adhesive in them, and which is, I think, why it is they're designed that way. Because if you're putting in the paste out of the tube or the powder inside the denture, a lot of people use way too much product than what is actually needed. And the denture strips have just the right amount so you don't get oozing out of the adhesive from the denture, which you just end up swallowing, but it's still enough to hold it in place in your mouth. Now, while I'm talking about adhesives, and like the person had asked in the question, mainly for the lower denture, because that's where most people have their problems, is with the lower denture. Most upper dentures fit reasonably well for people to very well for people. So normally it's the lower denture that needs the extra help. If you're using an adhesive, like let's say the paste adhesives, what you want to do is you want to put, normally I tell people 3 little dabs. And when I say a little dab, picture something somewhere around the size of a green pea, maybe a little bit more. put it, if we're talking about a lower denture, put it on the two back portions of the denture and then up in the very front. And the same thing for an upper denture. Put one up towards the very front of the upper denture and a couple in the back. And if you wanted to put a little dab right in the very middle in the palate of the denture, that would be great as well. And then ideally what you want to do is take something like a Q-tip and spread the adhesive around over the denture evenly. And then when you put it in your mouth, you should find that you should get a pretty good fit, and you're not going to have all this adhesive just oozing out the sides of the denture, which just ends up in your mouth. You end up swallowing it. It's really not nice stuff to use when you have that much in your mouth. But if you use it conservatively, you're going to be more comfortable. Your denture is going to most likely fit pretty good, and it's going to make your adhesive go longer, so you're not going to have to buy it as often. So the next question, great info. When you talk about implants, are you referring to regular implants or mini denture retained implants? I would love to get implants, but I'm not sure which route is best. I would love to know how you feel about regular versus mini implants, downside and benefits of each, your experience. Again, many thanks to you for taking the time to share your knowledge. Okay, so this is a question that I get asked in my office pretty regularly, whether the person should have mini implants placed or regular or traditional implants placed. And what it really comes down to is it's really going to be the practitioner's preference. Myself, I do not like mini implants. There's a few reasons for it. I'll go over them very briefly. And again, this is just my opinion. There's going to be people out there, if there's any dentists or oral surgeons watching this, there's going to be some of them who absolutely disagree with me. But this has been my experience with them, and it's why I don't use them. Every case I have ever seen that has mini implants placed, the people have lost implants. Mini implants have a much higher failure rate than conventional implants. And a lot of the surgeons placing the implants, whether it's an oral surgeon or a dentist, they normally place quite a few of the mini implants. Like having 6 to 8 mini implants placed in, let's say, your lower jaw to retain the denture isn't out of the ordinary from what I've seen. And then within, sometimes it's not a very long amount of time, whether it's a few weeks, a few months to a couple of years, a lot of people I've seen have had implants fail, and they started with 8 and now they're down to 5 or 6. Now, again, that is my experience, and maybe it's because I'm having people come to me, and the only reason they're coming to me is because they're having problems. So maybe I'm just seeing the problem cases. I have had a couple of cases where I have worked with a dentist, and the dentist wanted to place mini implants, and I was hesitant about it. And I said, okay, you know what? I'll work with the patient. We'll go ahead and do this. And even those cases, the two that I have done myself from the very beginning, both of those cases have had implants which have failed. So my personal preference is for standard implants. And that's really what it comes down to is, like I say, it's going to be personal preference for the practitioner. So let's talk now about the difference between mini implants and traditional or conventional implants themselves. And the first thing that you're going to notice is that mini implants are much smaller than conventional implants, normally by at least half the size, not in length necessarily, but by width. They are much narrower than a traditional implant. Also, you're going to see that mini implants are all one piece. We have the portion of the implant which is inserted into the bone, and then you have the attachment on top of the implant. There's different styles of attachments that could be placed on top of mini implants. The most common by far is a ball type attachment on top of the implant. So the mini implants are all one piece. When you look at a conventional implant, it is just strictly the implant itself. There is the portion that is inserted into the bone, and then everything on top of that is screwed onto the implant. So we have what are called abutments. The abutments are screwed onto the implant, and there are many different types of abutments. We have abutments that can be used to secure a denture. It snaps onto the abutment. There are abutments that can be used to accept a screw retained bridge, or a crown which is screw retained, or a crown which is cemented in place. There are angulated abutments. There are so many different types. So when we're dealing with conventional implants, the options for treatment afterwards are much greater. And I guess to a certain extent, if you have mini implants, to a certain extent, you're kind of locked into having whatever type of attachment can be placed on top of that mini implant. Because once the implant's placed, it's there. The only other option after that is to remove the implant. With conventional implants, you have many more options for treatment. Let's say you're missing just one tooth right now. So you have that crown made, and the crown can be either screwed onto an abutment, it can be cemented onto an abutment, the crown can be screwed to the implant itself. There's multiple ways of doing it. So that's right now, you have one tooth missing. But let's say down the road, you end up having to have more natural teeth extracted, and you want to have more implants placed so you can have permanent teeth. Well, now all that needs to go on is you place more implants, and then you put new abutments on, and then you make a new bridge. So you just keep on going. And if at a later date you decide that you want to do something else, the implants in the bone, the abutment can be changed out to suit whatever restoration is going to be there later on. So like I said, conventional implants, there are many more options for treatment. Sometimes a surgeon might look at the amount of bone that you have in your mouth. They will say, you know what, there's just not enough bone to place a conventional implant, but we can place a mini implant. That could be another option why mini implants might be placed. It's just there is no other option, and having this mini implant is definitely going to be a better option than no implants at all. So it's a long explanation, but there are many reasons, and probably even more that I didn't even go over here, on why mini implants might be better than conventional implants, or vice versa. And like I said, the main difference on which one's going to be better to get is going to come down to the practitioner's preference for who you're visiting. They're going to tell you, I either only place mini implants, or I love mini implants, I do them all the time, or they're going to say, like myself, I don't like mini implants, I'm not going to do them.